You brush your teeth in the morning. The bristles move across your molars, water pools in the back of your mouth, and for a few seconds your mind is completely empty. No thought, no direction, just the motion and the sound and the fluoride taste. For 12,000 years before that moment existed, humans woke up without it. And in that silence, in that unguarded, ritualless morning, something happened to some of them that the rest of the group had no word for, no diagnosis, no category. Just a person who one day started hearing a voice that wasn't there, or stopped eating, or walked into the river and stood there, staring at nothing, for 3 hours. And everyone around them had to decide what to do. In 2001, archaeologist David Lewis Williams at the University of the Witwatersrand in South Africa published a study examining 27,000-year-old cave paintings in southern France and Spain. What he found was not primitive art. It was a systematic visual record of perceptual collapse. Figures dissolving into geometry, animals with multiple heads, human bodies turning into something else. He argued that these images were not decorative. They were maps of altered mental states. And someone had to paint them, someone experiencing them. The oldest evidence of a human response to mental breakdown dates to approximately 6,500 BCE. In a burial site outside of Ensisheim, France, archaeologists discovered a skull with 2 carefully carved holes, both showing signs of post-operative bone healing. The person survived. The surgery was performed deliberately by someone who knew what they were doing. We call it trepanation, the removal of a section of skull to release whatever was inside. Here is what archaeologists found across 43 separate trepanation sites spanning Europe, South America, and Central Asia. A survival rate of roughly 65 to 78%. That is not a desperate act. That is a practiced one. Surgeon and bioarchaeologist John Verano at Tulane University analyzed 411 trepanned skulls from ancient Peru and documented that many individuals had undergone the procedure multiple times. One skull showed 5 separate healed openings. This was treatment, repeated, refined, and administered by someone trusted enough to hold a flint blade to a living person's head more than once. But here is where the picture fractures. Because the assumption, the one that feels almost too obvious to say aloud, is that these ancient communities feared the person who broke down, that they cast them out, that madness was exile, that the insane person wandered alone into the dark and was never spoken of again. The skulls say something else entirely. In 2021, bioarchaeologist Xian Halcrow at the University of Otago in New Zealand published findings from a Bronze Age site in Vietnam, dating to approximately 1200 BCE. Among the remains, an adult individual with severe degenerative joint disease, congenital skull abnormalities, and evidence of long-term physical dependency. They had been alive for years in a condition that required constant care. They were buried with the same grave goods as everyone else in the community. The community had kept them alive on purpose. Anthropologist Eric Trinkhaus at Washington University in St. Louis documented similar findings across Neanderthal burial sites. Individuals with healed fractures, missing limbs, deteriorated spines, all surviving years beyond the injuries that should have ended them. His 1983 paper in the Journal of Human Evolution concluded that care of the incapacitated was present in proto-human groups at least 50,000 years ago. They did not abandon their broken ones. They carried them. This is where something quiet begins to shift. When a person in a Paleolithic group started behaving erratically, hearing things, seeing things, speaking to something invisible, refusing food, the group did not have a hospital. They did not have a diagnosis. What they had was a fire, a social structure, and a set of accumulated knowledge passed from elder to elder across generations. In 1997, anthropologist Weston LaBarre at Duke University compiled cross-cultural records of shamanic traditions across 47 distinct indigenous cultures spanning 5 continents. The consistent finding: in the overwhelming majority of these traditions, the shaman, the healer, the one who moved between worlds, was almost always a person who had first experienced what the community could not explain. Seizures, visions, voices, periods of total psychological dissolution. The breakdown was not the disease, it was the selection process. The person who survived the collapse was considered to have been somewhere the rest of the group could not go. And when they came back, they were not rejected, they were elevated. But not everyone came back the same way. And this is where it gets darker than the shamanic narrative allows. Ethno-psychiatrist Georges Devereux, in his 1956 landmark paper Normal and Abnormal, documented a category he called ethnic psychosis, a form of mental breakdown specific to particular cultural contexts. His argument, drawn from fieldwork across 7 indigenous groups in North America and Southeast Asia, was this: every culture maintains a threshold. Below that threshold, the disturbed person is sacred. Above it, when the behavior becomes unpredictable, violent, or threatening to the group's survival, the response changes. The community that carried its wounded could not always afford to carry its dangerous. Archaeologist James Steele at University College London, in a 2000 study of pre-agricultural skeletal remains, documented that isolated individuals found outside formal burial sites, unmarked, unaccompanied, were statistically more likely to show signs of neurological abnormality or trauma-affecting behavior. Not proof of exclusion, but a pattern consistent with it. Two responses existed, side by side, in the same cultures, sometimes the same family. The one who saw visions was a healer. The one who became violent was something else. And the line between them was not drawn by the individual. It was drawn by the group in the moment, based on what the group could survive. That decision was not made in a clinic. It was made at a fire in the dark by people who were already afraid. Here is what the assumption was from the beginning of this account, that ancient humans feared mental illness because they did not understand it, that ignorance produced cruelty, that the modern world, with its hospitals and its categories and its medications, represents progress from a brutal default. That assumption is precisely wrong. The ancient response to mental breakdown was not one thing. It was a spectrum, more nuanced, more varied, and in many cases more integrated than what replaced it. The person who broke down was not automatically cast out. They were watched, assessed, sometimes elevated, sometimes contained. And the community made that determination not from a position of ignorance, but from deep accumulated embodied knowledge of what human beings look like when they are suffering. What ended that system was not cruelty, it was scale. When human groups grew beyond 150 individuals, the threshold identified by evolutionary psychologist Robin Dunbar at Oxford University in 1992, the intimate knowledge required to make those assessments began to disappear. You cannot know the history of a stranger's mind. You cannot read the arc of someone's suffering when you have never seen them before today. Institutions replaced intimacy. Categories replaced knowledge. The hospital replaced the fire. Look at your medicine cabinet. The orange pill bottle? Or the blister pack? Or nothing at all. Just the space where something used to sit before you finished the prescription. That object, or that empty shelf, represents an entire architecture of human understanding about what a broken mind needs. What it does not contain is the one thing that ancient communities offered first, before the trepanning and the ritual and the elevation: the certainty that someone who knew you had decided you were worth understanding. That was not replaced by something better. It was replaced by something faster. And you live inside what was built after the knowing stopped.